Hi guys, welcome to For Your Information, a show where I talk about some news that occurred in the past week and take a deep dive into a topic I care about. So a lot of things actually occurred this past week, from Otedola taking a Molue bus in Agege and the rest of the passengers not being the wiser, to the House of Senate finally passing the appropriation bill after 190 days. But in more serious news, 2019 is just around the corner, and many of these politicians are empowering people. So a representative in Borno State empowered 5,000 youths with, get this, I think I should come a little closer so I can hear what I'm about to say. He empowered them with shoe shining kit. Shoe shining kit. Not teaching them how to make shoes, but he gave them shoe polishing kit. It's okay. It's alright. Finally though, I'm sure by now you guys must have seen this video of our IG of police.
Effective transmission, apprehensive transmission in the transmission,
And trust Nigerians, they've already started doing remixes everywhere.
Lord Sky on the beat.
Transmission, effort at the transmission conclusion to transmission transmission could have effect, transmission.
One thing I just want to say about the video is a lot of people keep claiming it's edited, but I do not think, in my own opinion, I don't think it was edited. Because if it was edited and he was reading the speech very well, why did someone else have to stand up and start reading the words for him? Anyways, let's just move on. Today's main topic would focus solely on the Nigerian public health sector. But this is not to say that the private sector is without blame. I'm sure we've all heard the saying, health is wealth. So going by that logic, a country that is not healthy cannot be considered wealthy. And this much is true about Nigeria, because just like our economy, our healthcare sector is in shambles, or as Bill Gates puts it,
much of Nigeria still looks like a low-income country. Let me give a few examples. In middle-income countries, the average life expectancy is 75 years. In lower middle income, it's 68. In low-income countries, it's 62. In Nigeria, it's lower still, just 53 years. Nigeria is one of the most dangerous places in the world to give birth, with the fourth worst maternal mortality rate in the world, ahead of only Sierra Leone, Central African Republic, and Chad. 1 in 3 Nigerian children is chronically malnourished.
The healthcare system in Nigeria is so bad to the point where you hear stories of people getting rushed to the hospital and being told they cannot receive treatment because there are no beds available. Let's just let that sink in for a second. Someone is rushed to the hospital, probably at the brink of death, and is being told by a nurse or doctor that we can't administer treatment because there are no beds available. It's absolutely absurd. Even in the cases where there are beds available, some of these patients are not given the proper care or just plain neglected. In all honesty, the Nigerian health sector has failed its citizens in almost every possible way. But for the sake of this video, I would only touch on a few of those points. In terms of infrastructure, many hospitals are severely under-equipped. Even the ones with some equipment are outdated. The problem is so bad that some of these hospitals cannot even boast of pain medication or syringes, injections. The First Lady, Aisha Buhari, complained about this same issue at a public speaking engagement she gave at the presidential villa. She openly criticized the chief medical director of the Asorok Clinic, saying a situation where construction was going on in a facility that could not boast of syringe, was not good enough for the country. So if a facility that was built solely to take care of the president, vice president and their families does not function, what hope do we the masses have? On staffing, doctors and nurses in this country are severely underpaid, as evidenced by the incessant strike actions embarked on by medical practitioners. This mistreatment has led to a mass exodus of medical staff to other countries in search for better compensation. It is estimated that at least 2,000 doctors leave the country yearly for countries like the US, UK, and even South Africa. This brain drain has led our hospitals to be severely understaffed. The World Health Organization recommends a ratio of 1 doctor to 600 patients. But get this, in Nigeria, it's 1 doctor to 6,000 patients. The Nigerian Medical Association president said currently there are about 40,000 to 60,000 doctors working in Nigeria, which is a far cry from the 300,000 doctors that we actually need to run the country. All the issues of poor infrastructure and inadequate staffing can be traced to one major issue, which is budgeting. It's estimated that Nigeria spent 3.9% of its annual budget on health, which is a long way off from the 15% recommended by the World Health Organization. And it's no surprise that with such little allocation, the Nigerian healthcare cannot function well. With all these, it's no wonder that current and past leaders take arbitrary vacations abroad for medical treatment. If a sick president that knows the value of good healthcare would not receive treatment in this country, what hope do we that do not have the funds to travel abroad have of survival? To make matters worse, when asked about the president's constant medical vacation, the health minister had this to say.
The fact that none of our centers of excellence is good enough for our president to seek medical treatment in, is it some form of indictment on our healthcare system?
I don't think so. There's also a Nigerian angle to it. Nigerians are so secretive. We are also lax about data and information management. Let me tell you, the average Nigerian does not want his medical condition exposed.
From the response he gave, the excuse he's given as to the reason why the president is constantly traveling abroad for medical attention is that doctors in Nigeria are basket mouths that cannot keep information to themselves. So is he saying there's nothing like patient-doctor confidentiality? Way to inspire confidence in the Nigerian healthcare sector. In the face of all these issues plaguing the Nigerian medical public health sector, Nigerian medical practitioners still thrive, as exemplified by our ability to collectively curb and control the spread of the Ebola virus. Also, more recently, a group of surgeons in Yola were able to successfully separate conjoined twins. In conclusion, I'm in no way claiming to be an expert on health issues, but if the government should increase budgetary spending on healthcare, it would lead to better working conditions for medical practitioners and better healthcare for us, the masses. Bill Gates sums this point well.
If you commit to getting better results in health and education, if you spend more and more effectively, per capita GDP will stay on its course to make a remarkable post-recession recovery. This is the scenario we all want. Nigeria thriving because every Nigerian is able to thrive.
On a final note, I would say that every Nigerian will not thrive until the healthcare sector begins to function. Thank you.
Basket mouth won't start to leak again. Oh.